And we are live. Hello, tribers. How are you all doing today? Let's wait for a few more people to join us. If anybody can see us, please let me know if we are visible and audible. Yes. I can see that we are live on Tribe and we have people joining us. Please click the like button so we know that you have joined. Hurry up and tag all your friends. Let us know which city you're joining us from. Let's wait for a few more seconds till we have more people joining us. All right. So without any further ado, let's dive right into today's session. The topic for today's session is nutrient deficiencies in women, and we will be discussing primarily on iron, vitamins, and fiber. And for this session, we have with us an expert. We have dietitian Inshara with us. Inshara is a clinical dietitian with diverse experience in area of nutrition and dietetics. Her area of expertise includes providing medical nutrition therapy and nutrition counseling in diabetes, maternal and pediatric nutrition, metabolic disorder, cardiovascular disorder, PCOS, and other diseases. Welcome to the session, Inshara.
Hi, thank you for having me here. It's a wonderful opportunity to, discuss nutrition deficiencies and basically, one of my major field of interest is women's health. So, it's always lovely to have an opportunity to always discuss and educate women about their health and their overall well-being. It's always a good opportunity. Thank you.
We are glad you could join us today. So, without any further ado, let's go ahead with our first question. What are deficiencies such as iron, vitamin, and fiber particularly important to address in women's health? Why are they important to be addressed?
Okay. So first of all, addressing women's malnutrition or nutritional deficiencies in women, it has it should have positive effects on women's health, because as women have multiple roles to fulfill. Okay, we mean how we are mothers, we are working professionals as well, so we have to fulfill multiple roles, and for that, in that case, we are also doing on different activities, like generating income, ensuring our families are well fed, basically taking care of our family's nutrition, raising up healthy kids, and we are always into having a thought about what should we feed our kids, basically seeing the overall well-being of a family. So in this way, addressing these issues will help them uh, advance in their own themselves, to have a healthy home. And when something starts from your home, it spreads out. So basically, in one way, indirectly or directly, women is helping for the socio-economic development of the country as well, because if one thing starts from home, it passes out. And if one woman knows that if this is right thing for my family, or I'm doing the right thing, a good thing always, the well-being and the good things spread to other women, and in this way we all develop whole as a nation as well. So it is important to address these issues.
Right. And could you please share what are some of the symptoms that women should be looking out for to understand that they have deficiencies in any of these? For example,
Okay.
anemia is quite common amongst Indian women, but how can they
Yeah.
identify these common deficiencies in themselves?
Okay, so now iron deficiency anemia, it is one of the major nutritional and the most common nutritional deficiencies prevalent in India, and especially in women. Okay, so I'll look point out on the most common signs and symptoms. First of all, there's extreme fatigue. You feel tiredness throughout the day. You feel so lethargic that you feel energy. You feel you don't have any energy to even do the simplest of activities like climbing upstairs. It will make you breathless very quickly. then weakness, you have pale skin, your skin starts become, little, it starts becoming a little whitish yellow, it becomes very pale in color. Okay, then some women experience chest pain also because their heart is so over, when there is decreased blood and decreased concentration of hemoglobin that is responsible for carrying the blood in the body. So when there is not enough or adequate hemoglobin, the blood supply is not adequate to our cardiovascular systems. That, and due to that we feel, chest pains or breathless. We experience symptoms like this. Then poor appetite. The first and the most common symptom of anemia is poor appetite. You really feel anorectic. You don't feel like having anything. Then especially, women with severe or anyone with severe iron deficiency anemia, they crave to eat non-nutritive foods. Either it's like a chalk, or it's something, something related with a stone or something. They crave for these non-nutritive foods as well. Then if you go more into detail, then it is, soreness of your tongue, your mouth. You feel even your immunity power decreases, your hair starts falling off, you'll experience slight headaches and dizziness throughout the day. So these are the basic signs and symptoms that you experience on daily basis with when you have iron deficiency anemia. You are in mute.
Yes, there is a lot of disturbance here, so I muted myself. So, could you please shed some light on importance of vitamins in our day-to-day life? Like the commonly spoken about vitamins are vitamin D, B complex. Also,
Yes.
you can elaborate on all the other vitamins that are necessary.
Okay. So basically, vitamin D. Why I'm focusing upon the importance of vitamin D? It is the only vitamin, that is very deficiently available in our foods. Though we have enough, though we have it available in our foods in very less amount, but not an adequate amount that our body needs to, fulfill that adequacy. So the sun or the sunshine is the only source, adequate source of vitamin D for us. Now, why vitamin D is important is, for women, because as we approach menopause, as we we go through different phases of life. Pregnancy, menstruation, starting of your menstrual cycle. Then we go through pregnancy, lactation. Then we approach menopause. First and foremost, the bodily minerals start decreasing. That main focus is on calcium. So for the absorption or for the of calcium, the mineral calcium, vitamin D is very important. So absorption of calcium helps in maximizing the bones health. Plus, it prevents the a disease known as osteoporosis, in which your bones become more porous. When the calcium and minerals leach out from your bones, it leads to osteoporosis. Your bones become porous and brittle, and that leads to fractures. So, women and people with osteoporosis are more prone to fractures as well, and it leads the risk of morbidity and mortality due to osteoporosis or a low vitamin D deficient diet. Plus, vitamin D has certain immune modulating effects on the body, where it and also um, it has some anti tumor suppressing properties. So it helps in preventing certain types of cancers, like your breast cancers, your ovarian cancers, colon cancers. So it helps in prevention against certain kinds of cancers. As well as vitamin D is also um, helpful in women for boosting their mood. Basically, relieving the anxiety, symptoms of depression. That's why when women go through these menopausal symptoms or postmenopausal, premenopausal symptoms or postmenopausal symptoms, the doctor always advises that go in the sun, let themselves out in the sun, breathe in fresh air. So this will lessen their symptoms or improve their symptoms of emotional disturbances or some psychological disturbances as well. So it has an important effect on that. As well as for young women with PCOD, as well as premenstrual syndromes, it helps in curing it, or some way it helps in managing it, basically, you can say. Then apart from that, if you say in other vitamins, that other B complex vitamins, basically first three, B1, B2 and B3, these vitamins will help with your energy regulation. Then vitamin B12, B9, B6, these all will help in you preventing iron deficiency, anemia, will help in they help in basically making up your red blood cells. So all your seeds, your pumpkin seeds, flax seeds, your till seeds, your sunflower seeds are rich sources of these vitamins. So which you can take place in you, which you can include them in your diet on daily basis as well, and it helps prevent anemia. Secondly, biotin, basically your vitamin B7. It is again known as the beauty vitamin. It helps in your healthy growth of your nails, skin, and hair. Then vitamin, this what do we say? Vitamin B6 and vitamin B9 again helps in playing an important role in your your vitamin B12 also with pernicious anemia, all your nutritional deficiencies anemia, where our cells need to grow in the more healthier form, so that you can they can carry hemoglobin, make well hemoglobin and carry oxygen and blood throughout the body. It helps in that as well. And vitamin B9, usually during pregnancy and pregnancy, it is very important because for fetal development, it helps in reducing, neurologic defects like spina bifida and anencephaly, that is of the brain, huge brain, It helps in reducing these spinal or these neurologic defects in during your birth of the baby.
Right. Okay. So thank you for elaborating on all these points, because often we talk about these things, but we are not aware and how to pinpoint if some of these are happening with us, right? So these are great for
Yes.
awareness purposes. Also, to all the tribers, I would like to point out that one lucky commenter is going to win a goodie from SuperBottoms. So please ask your questions and let us know what your doubts for the session are. Let's move on to a few of our viewers' questions. How to manage small bumps on skin which develop due to age?
Okay. Now aging is perfectly normalized. Okay. Small bumps on skin, you have to make sure that they, first of all, you can visit a dermatologist. Now aging skin, if you're talking about a proper aging skin, all these vitamin B3, that is niacin, biotin, good intake of protein from right from the very start of your diet, vitamin C rich diet, all your citrus fruits, these are all vitamins that will help you in maintaining good skin. But if you're having any kind of bumps and all, then you can follow up with your dermatologist in that case, because that is specific skin related health. So your dermat will be the best person. But if you want nutrition from for a healthy skin, I can guide you regarding the nutrition that is related to your healthy skin.
Right. How do we how do we know we are having vitamin deficiency sometimes? We think leg or back pain is due to running behind the baby. But do we need to take any blood test on regular basis, like every 6 months or 1 year?
Yes. For every 6 months, you can get your, or whole body analysis done, or your routinely health checkup done. That is one of the best ways you can identify any kind of nutrition deficiencies. Plus, running behind the baby makes you feel more tired and all. It is okay. Like it will take up a lot of energy. But if something is very persistent, and if you have done all your home remedies and everything and nothing is working out, then you should definitely visit your doctor or your healthcare professional. You should seek help first and foremost in that way, because if something is at the very start of of your condition, it will be easily manageable as well as preventable as well. If you just keep ignoring it for a longer period of time, then it becomes difficult to manage, and you become so deficient that then you are last options to just put in anything in you, putting on your body in supplements on. just intaking supplements. Your whole body funda is basically based on supplements only. Then nothing from your diet will easily help you fulfill your deficiency. So if you know right from the very start, diet can help you, but if the deficiencies are prolonged, then you have to take supplements.
Right.
And you can do
Usually,
a regular blood test for your whole body checkup. If you go to any of the hospital or any of the diagnostic center, they have a list of whole body checkup, your vitamins, your minerals, deficiencies, and they will guide you along with it.
right. Usually, postpartum mothers are given vitamin D tablets as a must till 1 year. So, is it okay to take them after 1 year till we wean off the baby?
Till we wean off the baby, it is okay, you can take it unless but you have to make sure also, vitamin D, you are taking tablets also. But the main source of vitamin C should also be, like from the sun. You should also take care of your baby during that time, so that your baby is also adapted to getting enough amount of vitamin D from the sun, so that his respiratory system develops. It is very good for your respiratory health. So for mothers who are only taking supplements, you can check your levels. If they are normal, then shift to your normal normal source, or your just natural source, that is sunlight. And egg yolk and milk also has some amount of vitamin D present in it. You can follow that. But if you're too deficient, then you should continue with your vitamin D supplements under your doctor's prescription or advice.
Right. Okay. I feel frequent pain in left shoulder joints. After delivery, only I am feeling like this. Is this because of any deficiency? 6 months
Yes.
I'm facing this issue. Consulted doctor, but no use. Please advise.
Okay. So you should first of all check that your diet is rich in calcium. Okay, have a calcium rich diet if you are, and a protein rich diet as well. And if you are sure that your diet is, first of all, the absorption of calcium in our body is also restricted. Okay, restricted, that means if you have good quality or good amount of calcium, then only our body's requirement is fulfilled. If we just eat calcium rich sources on just a weekly basis, once or twice a week, that won't be sufficient to fulfill your calcium needs in your body. No. So ensure that you have daily 1 glass of milk or 2 glasses of milk it. I'm not saying that it will alone be sufficient for your calcium requirements, not at all. Your diet needs to be, rich in calcium throughout. And if you're still persistent with the problem, then sometimes we have muscle problems that needs to be, rectified under a physiotherapist or an orthopedic doctor. You can also indulge yourself in some exercises after pregnancy, with the help of some physiotherapists, so they will guide you the best in that. Basically, a calcium rich diet, a protein rich diet, and getting enough amount of vitamin D will help you solve most of your bone related problems.
Okay. The next question is, I'm feeling very weak and lazy and feel like no energy at all. I'm 35 years, so can I consume vitamin and iron tablets?
Yes, you can consume. First, get your whole body checkup done. Look on what kind of vitamins that you need. Basically, you may be deficient in most of your B complex vitamins, B12, B9, B6. There might be it's sounding, you might have symptoms of anemia as well, or it does not. Sometimes you have to get checked of your thyroid levels also, because when you have thyroid related disorders, you still feel this lethargic, you feel low on energy, because your thyroid hormones is basically important for your energy regulation only. So if these hormones regulation is disturbed, then how will your body produce enough energy to sustain yourself? So you must get these tests done, and then you can, follow up with a good diet plan regarding to your condition. And make sure you're having a well balanced diet, increasing your intake of, good amount of fruits and vegetables in your diet, all your whole grains, have a good protein rich diet, and iron rich foods may help you with that. And plus, having keeping yourself, physically active also. First you need to revamp yourself, build up energy, then you can start with your physical activity as well.
Okay. Is early graying of hair a sign of vitamin deficiency?
Yes, definitely, it is a sign of vitamin deficiency as well as protein deficiency. So you must look on to, you must boost up your diet that is rich in protein would include all your protein rich stuff, all your non-vegetarian foods. If you're a vegetarian, then you can include all your seeds. You can eat all your lentils, legumes, pulses. Okay, soya bean is a good source of protein for vegetarians. You can include all that.
I'm
And
quite active.
amla, for that reason, I'm sorry, for having good hair, prevention of graying of hair, and a good skin. Someone asked me with aging skin also. Amla in our Indian culture is one of the best sources of vitamin C. It will help you prevent graying of hair. I have recommended this to my patients, and they have seen changes that when they are having at least one glass of amla juice every morning, they have started having ingrowths also, good hair growth also, and the gray hairs are uh, getting off, and they're having good amount of black thick hair growing on them. So vitamin C in that case, amla is one of the best sources of vitamin C that we have available, and it is in our Indian culture as well as, so we can make use of it.
Right. I'm quite active throughout the day, but my heel hurts a lot at night. Is it because of keeping myself active throughout the day, or should I be consulting a doctor?
This maybe also look, now if you are a two if you have a whole hectic day ahead of you, and you are just busy throughout the day, and just your heel hurt, that may be due to some deficiency. It may be a calcium magnesium deficiency present, basically, that helps in muscle relaxation and contraction. It is a sign of some vitamin deficiency, so you can get your blood test in, or vitamin B12 deficiency also. You feel sometimes tingling and itching sensation and this pain in your heels, so you can get the checkup done as well. So that will be much better to rule out any deficiency for you.
Right. The next question is, Biotin gummies are now available in open market for hair and skin. Is it really helpful? Is it safe for all?
Safe. Now any type of gummy, so now these are all supplements. Okay, supplements will help you until and unless you take them, and after that you need to maintain it by diet. So why not just start on revamping biotin rich foods, all your fruits, vegetables, your nuts. These are all your biotin rich foods that you can include in your diet. Not I am not always saying that supplements are not safe. Only if it is medically prescribed you on, and only if you need it medically, then it is safe for you, because the doctor has some amount of recommendations for you. He will recommend you in some amount. Just looking at these ads, it and commercially, just taking this biotin, it will affect you. No doubt it will affect you, but you don't have the knowledge or right amount of recommendation to take it. And
I
unless and
had
until you take it, yes.
I had a similar doubt about melatonin supplements also nowadays that are
Hmm.
running in the market for sleep. Could you please shed some light
Hmm.
on that?
These all are supplements. These are just going to go into your body actually. Though it will help you, I'm not saying it will not help you. These supplements are made so that it will help you. And maybe your body is too deficient on it. But why not always try first the natural ways to get it? If your body, I'm also focusing on light on that. If your body is too deficient, then alone natural ways won't help you. Then you have to shift to in taking both those supplements as well as your natural food. But if you first try, if you can manage it through diet and in most natural ways, like for sleep as well, why don't you take walk after before sleeping? Why don't you get your body tired throughout the day? Why don't you practice meditation and all? So
Right.
we just don't have to give up on ourselves very quickly. We are nowadays in this 21st century, we as humans have become very impatient. If we don't see results in 1 or 2 weeks, or even in 1 month, any result or any response to a stimulus takes 4 weeks. After and only after 4 weeks, for in case of simple weight loss, if I follow a diet for 4 weeks, then only I will see the results. Before 4 weeks, I won't. And before 4 weeks, I become so impatient, and if nothing is working, I will just, do the rest of the things. So supplements will help, but only and only if it is required. Don't just burden or put dump in your body with supplements.
Yeah.
Then we give up on natural ways, that nahi, natural cheezon se to abhi kuch nahi hota hai. We'll just make the use of supplements, and that's the only thing.
Thank you so much for sharing all this valuable information with us. I do see a few more questions coming in, but those have already been answered. So, in case your question was not taken up, please take the time to watch this video after we post this. So, you will certainly be getting your answers. Uh, have we missed out on any points according to you which should have been covered?
um One thing I would just wanted to say about lifestyle also for women's. As women, we are always running behind. We are, as I said, we have to fulfill our multifactorial roles that we play. So, basically, we have to focus on eating a well balanced diet. If you are deficient in any of the nutrients, or if you are deficient in more of the nutrients, uh, don't follow the fad diets. If you're already deficient, then we should not follow the fat diet that we are getting onto, because first we need to nourish ourselves more nutritionally, and then we can follow the fat diets if you want to lose weight. So having a well balanced diet will help you. Indulging in lifestyle changes, like indulging in physical activity, adequate amount of 8 to 7 hours of sleep per day, boosting up your water intake. Okay, engaging in even moderate intensity activities like 30 to 40 minutes, that is recommended. It is very good. And plus, your overall health needs to be assessed every time. So
Great.
this is just the basic thing that I need to say about for women's health. And rest we can any time, if you have any concerns regarding, always and always, we have a lot of amount of information on the Google, no doubt. But we as healthcare professionals are always there to guide you in the right way, because nowadays people read something on Google, it is related to, no, this will be very dangerous for you. It just gives you a signal, and that increases the anxiety, fear, and stress, and we lose hope so quickly. So always seek for anything, always seek help through medical professionals. This is the only thing.
Great. Thank you so much for sharing all this information with us. I'm sure the tribers have a lot of takeaways from this session, and all of us are now geared up to take positive action towards our nutrition. So, thank you so much for being with us here today. Thank you so much,
Thank
tribers, for
you.
tuning in.
Thank you so
Thank you,
much.
tribers. Please go ahead.
No, I just said thank you.
Thank you, tribers, for tuning in. Stay tuned for more interesting sessions just on Parent Tribe by SuperBottoms. Thank you so much.